strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Are you a family caregiver? Are you caregiving for someone who can no longer take care of themselves? Are you overwhelmed? This is Caregiver Solutions Info with Marcia Teal. Marcia will be hosting an hour of true stories and information, tips and updates of the latest research and necessary information in the caregiving field, focusing on you, the family caregiver. An Alzheimer's disease and dementia care expert, Marcia has 15 years of hands-on experience at Arden Courts, a leader in assisted living dementia communities here in the U.S. Marcia covers everything you need to know as a family caregiver, especially if you care for a loved one with Alzheimer's disease or other related dementia or chronic illness. If you have a friend or relative that is also a family caregiver, call them now. They won't want to miss a minute. And let them know they can watch on caregiversolutions.info. And they can listen on WNN 1470 AM in South Florida or nationally on the iHeartRadio app. Now, sit back, relax, and learn from our host, Marcia Teal, as she brings information to you that may just be the caregiving solution you need.
Hello, and welcome to the Caregiver Solution Info Show. I'm glad that you could join us today. Today we're going to be talking about something we've never discussed before on the Caregiver Solution Info Show, and that is swallowing problems, especially swallowing problems of the geriatric population, including those who have had a stroke or who have Alzheimer's disease. I think it's real important to talk about this because caregivers need to be educated and they need to be aware so that during their caregiving efforts, they might be able to notice the signs and symptoms of a swallowing problem and then know what it is and what to do about it. So my guest today, she's a language speech pathologist. She's certified and licensed. She is especially experienced with over 20 years of experience working with the geriatric population in swallowing problems at hospitals, assisted living communities, nursing homes, and even with patients in their own home. She's also an adjunct instructor at Nova Southeastern University, and she is the president and owner and clinical administrator of Swallowing Diagnostics Incorporated. Joining me today is Deborah Tarakovsky. Hi, Deborah. Welcome.
Hi, Marcia. Thank you so much for having me today.
Well, I'm so glad that you're here, joining me from one of your offices on the west coast of Florida. I want to talk about this problem, and I think that, it is a problem in the geriatric population for many reasons, and I think that it's important for caregivers to be aware that it could happen to the person they're caring for and to be cognizant of some of those signs and symptoms that they should be aware of so that it doesn't lead to bigger problems, right?
Absolutely.
So the first, yeah, I mean, I've seen it myself working with people that have Alzheimer's and dementia, and they do have a lot of problems. I know it doesn't happen to everyone, and there's a lot of reasons why someone has swallowing problems, which you're going to tell us today. So that leads me just to go ahead and ask you, what are some of the causes of swallowing problems in the geriatric population?
Well, that is a huge question. Those causes are varied, and you already mentioned a few of them. You can develop dysphagia as a concomitant component of a disease. So, for example, you mentioned Alzheimer's. With Alzheimer's, you can develop a dysphagia or stroke. So after a stroke, you develop neurological problems, and those neurological problems cause the dysphagia. So dysphagia is actually a symptom. It's a symptom of a disease. So we wouldn't necessarily say the patient is diagnosed with dysphagia rather than they're diagnosed with a disease process like a stroke or Alzheimer's disease, and therefore they've developed the dysphagia. So it can be secondary to a disorder or a disease. It can be structural. So for example, if somebody's had a surgery in their neck, there's a procedure called a cervical fusion. And with that cervical fusion, they put hardware into the cervical vertebra, and that hardware can actually obstruct the structures in the throat, and you can develop a dysphagia. Or you can get a little pocket from a weakness in the throat, you can develop a pocket, and that can cause a dysphagia. Some other diseases like head and neck cancer, where patients have had chemotherapy and radiation, and actually the radiation to the tissues changes the structure of those tissues and can cause a swallowing problem.
So you mentioned dysphagia. What exactly is dysphagia, the definition of it, and how does that differ from aphasia? Because we hear both terms, dysphagia and aphasia, and I think sometimes we might get those confused.
Yes, and I think that patients, even clinicians that are not speech pathologists directly, can often confuse those two terms. So dysphagia with a D is correlating to a swallowing problem. And that swallowing problem can occur anywhere within the system, starting in the oral cavity, through the throat, which clinically we call that the pharyngeal cavity, through the esophagus as well. So you'll hear a gastroenterologist or a GI doctor say their patient has dysphagia. They're talking about dysphagia that occurs within the esophagus, as opposed to a speech pathologist talking about dysphagia. Typically, we'll be talking about a swallowing problem that occurs somewhere in the mouth or in the throat. That differs from aphasia, starting with an A. That refers to a speaking, cognition type of a language disorder. So whenever somebody has, let's say, the result of a stroke, they may have a problem understanding language. They may have a problem expressing themselves. Their speech or articulation may be affected. Sometimes reading or writing may be affected. And those are all forms of language, which we would term aphasia when there's a problem with that.
Well, thank you, because I think those terms can sometimes be confusing and somebody might interrelate them and not realize, the difference. And so very good explanation. Thank you. We mentioned Alzheimer's dementia. People with dementia, a lot of them have Alzheimer's type of dementia, where the brain cells are dying. And of course, the brain tells our body what to do. Our brain is the computer of our body, right? And tells us what to do and how to move and every single thing that we do. The brain can actually forget or not be able to tell the body how to swallow. Is that true?
In a certain term, yes, absolutely. So I don't think it's so much that the brain forgets, but as you mentioned, there is cells that are dying, brain cells that are dying. So that's our central nervous system. And as it changes and loses function, then the function of the body is going to change. So that can impact a lot of different things. That can impact your sensory system. So if you think about driving in your car, you left the house, you weren't hungry, but all of a sudden you get the smell of something delicious, right? There's a restaurant, and boy, that smell, you can even smell it in your car as you're driving by, right? I think that's happened to everybody at least once or twice in their life. And all of a sudden you start thinking about, oh, well, maybe that's what I would like to eat for lunch or dinner. Or you might even say, wow, I'm hungry. I'm going to go to drive-through or whatever. So it can start with something as simple as your sense of smell. Then we have our sense of taste, another sensory component. So if you put food or liquid in your mouth and your taste changes, that's going to change your ability to want to swallow, right? If you're used to eating something and it has kind of a bitter taste, let's say coffee, and now you've lost the bitter flavor, let's say. So the taste of the coffee is different. When you put it in your mouth, it's going to seem strange. You might hold it in your mouth and not want to swallow it because it's not what you expected. So you just sit there with it in your mouth, right? Or you may spit it back out because it's not that taste that you were expecting. So that could happen with any food or liquid. So sometimes we do see those behaviors in patients. Then there's another part of the nervous system that can get affected that affects what we call motor planning. So you take something into your mouth, and we do see this a little more commonly with the stroke type of a patient, but it can happen with various types of Alzheimer's or dementia, and you don't really know exactly what to do with it. So the person's holding it in their mouth, and it's not really that the brain forgets, but the motor planning that happens from the brain to the muscle gets lost. And all of a sudden you lose that system that tells you, hey, you're supposed to take this piece of food, move it over to your teeth, and start chewing it. And then you have to grab it back over into your mouth and push it to the back of your mouth. So it's a very complex system, as simple as it seems, because we develop those motor plans as we grow up from babies, right? The first thing, we don't have to think about swallowing as babies. We latch, suck, and swallow. It's a natural process. And as we age, those natural processes continue. So we don't think about it. So it seems very strange to say or think, oh, our body's forgotten how to do it. But in a sense, it is kind of what happens.
So when people have that food in their mouth and they don't chew it and swallow it like naturally, like what we all would do, and it just stays in their mouth, or sometimes they kind of squirrel it away. They have big cheek, like squirrels like this, big cheeks, and they call that pocketing of food. Is that what you're talking about?
Yeah, that is absolutely some of what we see. We see a lot of patients that, they'll just kind of hold it in their mouth. They put it on the side. Like you said, we call that pocketing. And either they may have lost the sensation there, so they don't know that it's there, or they've lost the motor planning to know what to do with it, to kind of know, okay, I have to use my tongue, scoop it out, bring it back into my mouth, and push it back again. Sometimes we've lost some of the finer sensory systems that tell us the difference between what's a liquid, what's a solid, what's sharp, what's hard, what's soft. So we do that very naturally when we put, let's say, a cracker in our mouth. You don't think about, does that have a sharp edge or not, right? You just know innately you're supposed to chew that up until there's no more sharp edges, until it feels ground down. We actually chew it naturally down to a puree texture, and then we swallow that. And it's funny because as speech pathologists that specialize in dysphagia, we talk about the fact that everything we swallow is really, when it's a solid food, it is pureed before we swallow it, because we naturally chew. Yeah, we chew it and grind it down to that puree texture, hopefully. Sometimes we all go a little fast. You really like something or you're starving and you put it in and swallow it down, and then you feel it go down, right? But if we're some of the neurons that control those things, then we lose the ability to do that.
This is so interesting. We have to take a quick break. When we come back, Deborah Tarakovsky is going to be sharing more about swallowing problems in the geriatric population. We'll be right back.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-8255 2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. You are listening to your host, Marcia Teal, an Alzheimer's disease and dementia care expert on caregiversolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
My guest today is Deborah Tarakovsky. She's a licensed and certified speech-language pathologist and the president and clinical administrator of SDI, which stands for Swallowing Diagnostics Incorporated. So we're talking about, Deborah, people not being able to swallow their food, maybe pocketing it in their cheeks because they've lost that ability, maybe because of dementia, to plan that action. It doesn't come normal or natural to them anymore. What, are other signs? Obviously, if someone's pocketing their food and squirreling it away, that's obvious. You can see that as a caregiver. And then they're not swallowing, and that's going to have its own issues. But are there other signs besides that a caregiver could watch for in their loved one while they're eating that might tip them off that there are swallowing problems?
Yes, absolutely. I'm glad you asked that question because you're right. Things like not swallowing, putting food in your mouth and chewing a little bit and just keeping it there can be obvious to the caregiver, or just not eating and drinking because the food is sitting there left on your plate if you only are able to get 1 or 2 bites down. But some of the little bit less obvious signs that a caregiver can look for is intermittent coughing or throat clearing throughout a meal. So if you're noticing your patient or family member just kind of clearing their throat like that throughout the meal, that would be a red flag that there's a swallowing problem. Coughing, robust coughing, of course, would be an obvious problem that there's a swallowing disorder. If there's changes in respiration, so in breathing patterns, so if all of a sudden you see an increased respiratory rate, that can be a symptom that some food or liquid has gotten down the wrong way. So as food or liquid gets in the lungs, there's less room in there, and you might see that respiratory rate increase. That's something that you can watch for. In the dementia population in particular, I'll watch facial expressions also. So sometimes people can't exactly say the way that they feel, but they know the way that they feel. So they'll get fidgety in the chair. Again, they're not eating as much, and you'll start to see some grimacing in the face. So, maybe like little grimaces when they're swallowing can be a symptom of a swallowing disorder. And then the obvious, problem, that you might see also, which could happen with you or I, if you feel something's going down the wrong way or it's getting stuck somewhere, you might actually kind of touch that area. So that's another thing that is a possibility.
So besides not eating and not getting nutrition and not gaining weight or keeping your weight and being able to have the nutrition that your body needs to live, what are some of the other side effects that could happen if people have swallowing problems? What could be the dangers of that?
Well, I think that you just mentioned some of the various serious dangers of it, like weight loss. So we don't probably think of, losing a few pounds as a serious side effect of anything. I could lose a few pounds right now, and I wouldn't be complaining about it. But if that goes on over a longer period of time, what we have to remember is how is the actual nutrition and hydration of that person being affected? So we need to eat a balanced meal. We've learned that since we were children, right? But that's something that's very important in order to keep our metabolic system in check, right? To keep our organs functioning correctly, we need adequate nutrition and adequate hydration. So without either one of those, we're going to see some serious effects on the body. So if someone isn't drinking enough, which is very common with later stages of Alzheimer's, where people just kind of, they stop drinking a lot and they think they already drank enough and don't bother me. And I say all of these out of firsthand experience, as my mom had Alzheimer's dementia. So, we had that little bit of a battle with her, and you try not to make it a battle. You just try to offer things a little bit differently. But whenever you have nutrition and hydration impacted, it's going to impact the body system. So you can end up with things like kidney failure, recurrent urinary tract infections. Again, lots of changes in the metabolic system that can impact vital organs and end up with other problems that are much more serious than the fact that the patient just really isn't eating and drinking a whole lot. So there are those pieces of the puzzle of just not eating and drinking. There's also the dangers and risks of food or liquid going down the wrong way. And that's the big one for a speech pathologist. Those are probably the two biggest ones. Getting nutrition and hydration, and then the possible complication of what we call aspiration and possibly aspiration pneumonia if food or liquid goes down the wrong way and gets into the lungs. So the layperson would probably say, oh, it went down the wrong pipe. And then that's that coughing that you would see. But if your sensory system is impaired, so if you're not feeling things correctly, you might not cough and things are going down the wrong way. So you have to look for subtle symptoms, what we were talking about earlier, some of that grimacing maybe, or respiratory rate changes. Spiky temperatures can be a symptom of having aspiration going on, what we call silently. So you might have heard the term silent aspiration, where you're really not seeing that coughing or throat clearing, or even like a gurgling sound to somebody's voice can be an indicator that things are sitting in the throat, sitting around the vocal folds, or passing lower down into the trachea and possibly getting into the lungs.
Well, you mentioned liquids, so I'm curious, do liquids and food have the same concern? Because if someone can't chew their food, somebody might say, well, we'll just give them liquids. But if they're not able to swallow even certain liquids, then what happens?
Right. So there are different problems that people may encounter with solids and or with liquids. So with solids, we have the problems that may occur in the mouth, in the oral cavity, with chewing, the sensory information to say, hey, this is what you're supposed to do with the food to actually swallow it. So it is pretty common, as we already spoke about in this population, for people to hold food. And sometimes we'll use a technique of taking a little bit of liquid to help them swallow the food down, or using something that they really like maybe an ice cream or an applesauce, and just alternating that so that they swallow it. But the risk of not chewing food and swallowing that, or not being able to control it in the mouth and it falling back into the throat, is the possibility of the food actually lodging in the airway and ending up with a choking episode, which is much more dangerous than a little food or liquid even getting into the airway, because a choking episode is life or death at that moment. And you have to be comfortable with what do you do in that situation. So as a caregiver, I would think that one of the number one things, if you think somebody might have the potential of developing a swallowing problem, is to learn that Heimlich maneuver so that you can jump in and do that if you need to. With liquids, we usually get a little more concerned about those falling down into the airway at some point, whether, again, if it's because of a sensory problem or coordination of breathing and swallowing, or just a coordination in when the swallow occurs. So we're at a risk for getting that liquid down in the lungs. Now, whether you get food or liquid in your lungs, have the potential of developing an infection. And if you do get that infection, that's what pneumonia is. So aspiration is actually the food or liquid going down the wrong way. That food or liquid turning into an infection is pneumonia. So they are two different things, and the pneumonia is actually what we're concerned about. We all get a little food or liquid, not food probably, but liquid or saliva going down the wrong way. But when we're healthy and we have a strong immune system, our body can deal with that. It can fight it off. Our lungs clear out, and we do okay. And when we're more frail and our immune systems aren't as strong, the potential for developing an infection in the lungs goes way, way up, and then we get that concern for developing pneumonia. Our body can't always fight that off as easily also, the more medically fragile we are. So we have to be more careful with those types of patients that are medically fragile.
Absolutely. It's happened to me before. You drink something fast, it goes down the wrong way, but we have our reactions to it, and we can cough and get ourselves back on track. Is that why some people find it necessary to have what we call thickened liquids? So does that help somebody so that that little trickle of liquid doesn't go down as easily into the lung, where they have a thicker consistency?
So typically, thickened liquids are utilized because of some of the things we were talking about. So if somebody has lost sensation, they might lose control of a liquid. If you think about taking water and putting it in your hands, if you cup your hands together, it's probably going to trickle everywhere. You don't have much control over it. But if you put some pudding in your hands, you can control that pretty well. So if you think of a thickened liquid in that manner, if you put liquid in your mouth, it can fall everywhere and fall back into the airway very quickly. Or if the airway isn't closing 100%, it can squeak through those little cracks. Where a thicker liquid, we can control it a lot better. It moves a lot slower, so it gives more time for the airway to close. So if we have some coordination problems going on, that may just give that little bit of time for the airway to close up. But I do want to mention, as long as we're talking about thickened liquids, and what we call that in the speech therapy world is modifying somebody's diet. So you might modify a solid to something like a puree or very soft foods, and a liquid, you might thicken their liquids to help somebody with a swallowing problem. But that is always the last line of defense. So we're always going to try to look at what else can we do here to make swallowing safe for the person, but keep them on food and liquid that's as close to normal as possible. So sometimes it's just a matter of controlling the size of their bite or their sip. So sometimes a larger sip can help, sometimes a smaller sip can help. Sometimes a certain texture can help. So you might want to cut the food up for the person, something as simple as that, rather than immediately looking at modifying the diet. Because something like thickening liquids can impact what we talked about before, which is if someone isn't drinking a lot, and now you're going to thicken their liquids, they might drink a little bit less. And so then you're risking dehydration. So you really have to balance that out and say, okay, what is the best course for this person? Is thickening the liquid so they don't get it down the wrong way the best course? Or is looking at maybe modifying the size of the sip they take? So some people like to drink from a straw. That's just what they've always done. They love it, but it makes them take a really big sip. So you might have to take the straw away and say, okay, take small sips from a cup so that they can control that liquid a little bit better. But that is why it's very important to always consult a speech pathologist who knows how to look at all of these different things.
Well, I'm glad that you're here to talk about this. There's a lot to know and to learn when it comes to swallowing. And we're going to take a break and talk to the people about our sponsor, and we will be right back. Don't go away.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. You are listening to your host, Marcia Teal, an Alzheimer's disease and dementia care expert on caregiversolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
I'd like to take this opportunity to thank our national sponsor, Arden Courts Memory Care Communities. Arden Courts is a leader when it comes to taking care of people with memory problems and Alzheimer's and other related dementia. They have about 55 communities across the United States, and they're a great resource for you, the family caregiver. As such, they'd like to offer you this free book. It's called The 36-Hour Day. It's a wonderful resource for family caregivers, learning about Alzheimer's, dementia, challenges that you're going to face going down the Alzheimer's caregiving road, and things that you can learn, and a lot of topics that would be very helpful. And so all you have to do to get this book is to let us know that you saw the show and email us at delray@arden-courts.com. That email address is delray@arden-courts.com. Email us, let us know what your name and address and phone number is, and we'll make sure that we get a book sent directly to you as soon as possible so that you can have this really, really wonderful resource to share with someone that you know that could use it, or for yourself. So my guest today is Deborah Terakowski, and she is a licensed clinical speech and language therapist. She is so knowledgeable. She has been working with the geriatric population for over 20 years in hospitals, assisted livings, nursing homes, and with people one-on-one in their own home. And we're talking about swallowing problems today. So Deborah, we've talked about signs of swallowing problems that someone may have, what to look for, some of the things we can do to help people to swallow liquids and food better. But there comes a point in time where maybe we need to really find out what's going on or what's next. Is this where the testing comes in?
Yes, I always tell patients and other practitioners, if you're questioning if somebody has a swallowing disorder, immediately consult with your physician on that. And you can even ask to consult with a speech language pathologist. So there are two different types of examinations, well, two definitive types. One is your clinical examination, where your speech pathologist will come and meet the client and talk with them, ask questions, and do some preliminary examination, and actually watch them eat and drink. So that's what we call a clinical bedside examination. And from that point, the job of the clinical bedside is to make the decision as to whether a patient needs an instrumental swallowing study. So that's what we have been at my company focusing on for the last 20 years, is the instrumental assessment called the Modified Barium Swallow Study. So that type of an exam is actually as easy as taking an x-ray. So if you've had an x-ray before, you know it doesn't hurt. You barely even know that it's happening if you didn't hear the click on the machine. But this is like a movie of an x-ray. So the patient does have to come into the fluoroscopy suite, and eat and drink different foods and liquids, and the x-ray is running as the person's swallowing so that we can see where the food and liquid is going. So we actually watch it from the time it's in the oral cavity, watch how all the muscles are controlling all the food and liquid in the oral cavity, and then as they swallow and it moves through the throat, we watch that the airway is closing up well, that everything's coordinated when somebody swallows, that all the muscles are squeezing and doing the job that they need to do, as well as we watch it move through the esophagus and down into the stomach. So this is where we really get to the nitty-gritty of the problem. Otherwise, we're doing what's called an educated guess, which you can glean a lot of information from that clinical bedside assessment, but you can't really see what's happening inside.
So once you do this specialized test, and it's actually like an x-ray video, and I can just picture that in my mind, and you're actually watching the food going in the mouth, down through the esophagus and to the, places it's supposed to be. So you're watching this in order to find the point or points that are problematic with this person?
Exactly. And when somebody's swallowing, a difficulty in swallowing can occur from any point of bringing the food to the mouth. It can occur at any point in the oral cavity. It can occur in the throat, or it can occur in the esophagus. And this is a connected system. And I don't want to leave out the lungs too, because breathing plays a really important role in swallowing. When we swallow, we can't breathe. Otherwise, we'd be pulling food and liquid into our lungs. So this is one point where we do expect the person to stop breathing, for the airway to close, and for the food to safely be able to pass through the throat and enter into the esophagus. So it's a highly coordinated system, once again, that we don't think about very much until we start having difficulty with it. And the only way to see what's happening is to look with instrumentation.
So does this test take a long time?
The actual procedure itself is, like I said before, it's very easy. And depending upon the person, you sit under x-ray or at the x-ray machine. You're not actually under x-ray that whole time, anywhere from 5 minutes to 15 to 20 minutes. Maybe getting average is 2 to 3 minutes of actual x-ray in that time. The setup of it is slightly different depending upon where you have it done. So if you go into a hospital or into a mobile unit such as ours, the environment might look slightly different, but the procedure itself should be quite similar depending upon the accuracy.
Right. So once the person has the test and you've pinpointed a problem, then what happens after that? How do you address that problem? Do you have a plan in place? Do they have to go the next step? What happens after that?
Yeah, that's a great question. Because a lot of people go into a test and they don't understand why they're going into the test. They don't know what's going to be done, and they don't understand what's going to happen afterwards. And sadly, through my 20 years of experience doing this, I have found out that sometimes those questions never get answered. So as somebody going in for the procedure, whether you're the patient or the caregiver, you should know that information. You should know the reason why the test is being performed. You should know what to expect from the procedure. So as I said before, the procedure is very easy. It's a simple x-ray procedure. And what we do in the fluoroscopy suite is we mix a little bit of barium with normal foods and liquids that you would regularly eat and drink on a daily basis. So you're not drinking a container of barium. There's another test called a barium swallow, which they give you a container of barium to drink, and they're really watching the movement of the esophagus for that test. This test is a bit different. So on our trucks, we have a water mixed with barium that we always start with 99% of the time. And then for the foods, we're using different viscosities or different consistencies to see how that's handled in the mouth and the throat. So we'll mix a little bit of barium into some applesauce That's our what we call puree consistency, nice and smooth. We mix it onto a cookie so we can watch some soft chewing. And then we mix it onto some chicken, which is a meat, which takes a lot more work for the tongue, the jaws, and the teeth to handle. And then we look at what's called a mixed consistency, where that represents foods that have a solid and a liquid together. Common things would be watermelon or boiled vegetables, cold cereal, things that you eat, a solid and a liquid together. And the system handles that quite a bit differently than a solid alone or a liquid alone. So we watch all of those under X-ray, and we're going to identify why something's going wrong, if something's going wrong. So is it a timing issue? Is something supposed to happen in a certain sequence and it's happening out of sequence or very slowly? Or are the muscles not strong enough to do the job that they need to do? Or is there a coordination problem? So we're going to look at all of those types of things under the X-ray to identify what the problem is. Once we identify what the problem is under X-ray, that's the time we're going to say, hey, what can we do about this when the person is swallowing to make it easier for them to swallow? So that can consist of some of the things we already talked about, like using a straw or taking a straw away, taking a big sip or taking a small sip. Or it could consist of a change in posture, like putting your head down or turning to the side. So those are some examples of some things we might try during the test. After the test, that helps us to focus in on what the treatment program is. So by the time I'm done with this procedure, I've already found out what the problem is and what I need to do about it. So do I need to do a diet modification? Or can I just try some of those compensatory things like I just said, put the chin down or use a straw? And then I'm going to be thinking about the treatment program. So how do I make this better, if I can make it better? What kind of exercises can this person do to try to either make the problem less of a problem or make the system stronger? And that's...
Well, I love that.
I'm sorry.
That's okay. It's the technology, right? So I love that not only when someone goes for a swallowing diagnostic test, it's confirming to the caregiver, yes, this person does have a swallowing problem, but I love that then too, they get the treatment options and instructions of what to do to correct that problem, to help the person to swallow better, easier, to make it more enjoyable for them. So they're actually getting the instructions and the treatment of what to do going forward, which is the whole reason for the swallowing test in the first place, because if it was just a test to confirm, then nothing would change. So I think that it's really, really important so that caregivers understand that sometimes they know, oh, cut a smaller piece of food, but they don't know what things like you said, where exactly is that problem happening? What part of the whole, process is it occurring? And there are things that are specific to do to that person, like turning your head a certain way, up or down, sideways. Too many things that a caregiver, should not try to guess on their own and need a professional in order to help this person. So I love that. We're going to take a quick break and we'll be back with more from the speech language pathologist, Deborah Tarakovsky, and we'll be right back.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, And we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. You are listening to your host, Marcia Teal, an Alzheimer's disease and dementia care expert on caregiversolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
We're talking about swallowing problems today, especially in the geriatric population, when people that may have had a stroke or may have a diagnosis of dementia. And my guest is Deborah Tarakovsky. She's a speech language pathologist who is an expert in this field for over 20 years, helping people not only to diagnose the problem, but teach them how to correct it. So, Deborah, thank you again for all this great information for caregivers to know. You mentioned a few minutes ago about a mobile truck, and I want to talk a little bit about that because traditionally people would probably go to a hospital to have this type of a procedure done, a barium swallow test, but you've been providing a mobile service for the last 20 years, and I was wondering why the mobile, and are there any benefits to that?
Yeah, that's a great question. In the mobile industry, I would say this isn't something that the general public knows about because swallowing problems are really a very small community. Most people have heard of strokes, but they haven't heard about dysphagia, even though they kind of go hand in hand. So when people think of a test that they have to have done, they do think immediately about going to the hospital for that test. And as you said, we've been doing this for 20 years. So having people like you here to talk a little bit more about swallowing and the ability for people to get this on a mobile basis is really fantastic. It helps to get the word out there because there is a big difference. When you go to a hospital, one of the major differences is that you have to go through this whole outpatient procedure if you're not already in the hospital. So you have to make an appointment and go and do a whole sign-in process and sit in the waiting room. And for most people that are elderly and have a swallowing problem, typically there are a few other things maybe going on with you medically that don't make that whole process so easy to go and sit in a waiting room for a couple of hours. Whereas with our mobile units, we do go to patients' houses. We go to assisted living facilities. We go to nursing homes where we'll pull up right into the driveway if we're going to somebody's house. And they walk out of their house, step on our unit, and we're right there ready to start the procedure. So typically, someone is with us for anywhere from 15 to 30 minutes, and the test is done. They have their results, at least preliminary results that we explain to them, and they're walking off of our truck having a pretty good idea of what's going on with their swallowing. In a hospital, it's more common that, like I said, you're going to go through this whole process of signing in and sitting in the waiting room and then going in for your test and leaving and not knowing a thing. So there's a big difference there in the education level that you're going to get. As well, within our organization, we have a very strict training process that we do with our therapists because this is all that we do. We are dysphagia specialists. We focus on swallowing, and even more particularly, we focus on the modified barium swallow study. So when a speech pathologist goes through their master's degree and goes through schooling, they come out of school, but typically with no particular training in performing modified barium swallow studies. And there's not a lot of places to get this training, so we have to assure our clinicians are highly proficient and can operate up to our standards. So they go through a very rigorous 2 to 3 month training process before they are completing testing on our trucks independently. So that's another advantage of a mobile unit. We hold very high standards with our therapists. You also get the advantage of having multiple clinicians. So we always have either a nurse practitioner or a physician on board the truck with us, doing a consultation with that patient as well. So we're giving a very thorough, in-depth examination of the patient, not only with their swallowing, but their whole body system. And oftentimes that helps us to get to the bottom of the problem with that patient, because they're going to be looking over medications which can cause problems in the system. They're going to be doing a full system assessment as well to just, like I said, try to get to the bottom of why is somebody having the problem that they're having. And sometimes it can be as simple as there's interactions in medications that are causing, let's say, dry mouth or dry mucosa within the system, and that alone can affect swallowing. We need saliva to be able to swallow. If you've ever had a really dry mouth, speaking and swallowing gets very, very difficult with a dry mouth. If you think of the term cotton mouth, certain medications can cause that, and it makes speaking and swallowing very difficult. So I got off onto a whole tangent about that. We were talking about the differences and advantages of having a mobile unit. So the convenience of having it pull up to you, the expertise as well from the staff that's going to come out to you, and the efficiency of it, I think are probably the biggest variables.
Well, that sounds great. It's like your one-stop shop with everything there, all the experts in one mobile truck to help everyone. And we only have a minute left, but if there are caregivers or people listening or watching our program today and they want more information, or maybe they think their loved one may be experiencing some of those signs of swallowing problems we talked about, how can they get more information? Can they contact you for setting up a swallow test? How does that work?
Yes, the best way to do that would be to contact our office to set up a swallowing test. Even though our offices are located on the east coast of Florida in Parkland, Florida, our units travel throughout southeast Florida, anywhere from Homestead north through Martin County on the east coast of Florida, and on the west coast of Florida, we travel anywhere from Naples all the way north through Newport Richey, Tampa, into Polk County. So we travel quite a wide range here in South Florida. So we do have a website, swallowingdiagnostics.com. If anybody wants to go on and take a look at testing and what our trucks look like, you can get a good look there. And then to call our offices as well to go ahead and schedule an appointment. So,
and what's that number, Deborah? Give the number real quick.
954-578-4000.
Okay, so Deborah, you have been a gem talking about the swallowing problems, but Swallowing Diagnostics Incorporated can help. So call Swallowing Diagnostics Incorporated, go to their website, get the information, set up an appointment to get tested. You'll be glad that you did and have a lot more peace of mind knowing what you're dealing with. Thank you for being with us today, Deborah.
Thank you for having me, Marcia. If anybody has any questions, call us at 954-578-4000. You can ask to speak with me. I'd be happy to answer any questions that you might have.
That's perfect. Well, I've enjoyed talking with you, and I'm happy that you all could tune in and learn about swallowing problems on the Caregiver Solution Info Show. We'll be back next Tuesday, 6 to 7 p.m. Eastern Time. And until then, give someone a virtual hug if you can't do it in person. And don't forget to call or email for your free 36-hour day book, delray@arden-courts.com. And we'll see you next week, either on the iHeartRadio app under WNN or on the website caregiversolutions.info. Take care, and we'll see you next time. Bye-bye.
Thanks for joining us for this week's Caregiver Solutions with Marcia Teal. Join us next week as Marcia, who has 15 years of Alzheimer's disease and dementia care experience, brings you more needed information to help with the care of your loved one. This show can be seen again on caregiversolutions.info, and questions can be left on the site, which may be used on the program to help others. See you next week for more Caregiver